Maxine asked about osteoporosis and bone density testing. Osteoporosis is characterized by low bone mass and density, and there are no symptoms until there is a fracture. Your skeleton is alive, and there are cells that constantly remove bone and other cells that constantly put down new bone. Osteoporosis happens when the cells putting down new bone can't keep up with the cells removing bone. This process worsens with age because estrogen helps regulate it and puts women at over age 50 at greater risk for fractures once they reach menopause. Osteoporosis can happen to men and rarely children, but is most commonly a disease of postmenopausal women. Osteoporosis is a medical diagnosis and usually needs some sort of testing to guide treatment options. The most common test done is bone density testing, and the DEXA or DXA scan is the most widely used. Both are names for the same test, and DXA stands for dual X-ray absorptiometry. This is a test that uses high-energy X-rays and low-energy X-rays to image the hip, as this is the most common site to fracture in a fall. This is a low dose of radiation, and the accuracy of the DEXA scan is greater than 90% at the hip. The DEXA result is given a T-score compared to the bone density of a 30-year-old. A score above -1 is considered normal. A score of -1 to -2.5 is osteopenia, which is low bone mass, and a score below -2.5 is defined as osteoporosis. The T-score is used to estimate your risk of developing a fracture. The risk of fractures is increased with age, body weight, history of a prior fracture, family history of osteoporotic fractures, and by lifestyle issues such as cigarette smoking and alcohol consumption. Some medications can also affect risks, with corticosteroids such as prednisone being high on the list if it's taken chronically. Talk to your provider about risks. There are some things you can do to reduce your risks of getting osteoporosis. Weight-bearing exercise and a healthy diet will help keep bones strong, and avoiding excessive alcohol is important. Getting rid of non-traditional tobacco use is key. We can help you stop smoking. In some cases, these interventions might not be enough. There are medicines to help increase bone density, and you can discuss this with your healthcare provider. A hip fracture can be devastating, and prevention is the best treatment. Remember to call an elder. They've been waiting for your call. I'm Dr. Arnie Vinio, and this is Health Matters.